So, hello to Professor Jon Wandle. We're at the 2021 CMA conference. Hello and welcome.
Thanks, Rebecca. Thanks for having me.
It's lovely to have you here. You just presented a fascinating talk about many different subjects, but one of the areas that I was particularly interested in is about the complexity of naturopathy and complementary medicines. Would you be able to talk a little bit further on that?
Yeah, sure. So I guess one of the key differentiators of naturopathic medicine as an approach to more conventional approaches is that sort of move away from a reductionist model to help to actually embracing complexity. So if you think about the body, the body is one of the true complex adaptive systems. So you have hormonal systems interacting with for reproductive hormones, interacting with inflammatory hormones, interacting with microbiome, interacting with diet, interacting with the neurobiology. So nothing's actually completely separate. And I think the way that natural medicines tend to work is sort of on that more complex and nuanced approach, and that's the way that naturopaths work in as well. They don't just sort of play in that space; they live in that space. That is actually what they do. So, there's a real, I guess, synergy between the profession and the tools of trade that it actually uses in terms of that. So we know, for example, that if you're using a nutritional supplement for inflammation and you use another one, it's not just about the two products individually. It's about the synergy that actually have the potentization. So this product won't work with this product, but it will work with this product better. And it needs to be individualized. So saying that this product works in this condition is a little bit too simplistic, and I think really needs that sort of approach, from not necessarily a practitioner, but from a prescribing perspective that actually understands that individualized nature and that sort of the way that complexity actually plays out in the body.
Absolutely. So what would you say examples of synergy in nutritional medicine, for example, or herbal medicine, or either?
Yeah, sure. Well, there's quite a few examples. So you can look at it from purely a product combination perspective. So we know, for example, that using vitamin C in certain cancers or inflammation works very differently compared to depending on which product you use. So turmeric actually is quite a good combination, whereas if you're combining with a herbal intervention that might be like echinacea or something, not so much. So and actually the sum is actually more the whole is more than the sum of the parts. There's a systems approach. So if you're looking at a treatment, so I work in endometriosis a lot, for example. It is one named condition, but it has a hormonal, a genetic, inflammatory. There's a microbiome component. So a single approach is just not going to work effectively in most patients, and the same approach is not going to work in most patients. So, there's and the other approaches too. Just the pharmacological complexity of conventional approaches and other approaches. So, a lot of us think about drug-herb interactions or drug-nutrient interactions. What we probably don't think about a lot is the potential for them to be positive interactions rather than negative interactions. So. We're working with people in Phoenix at the Southwest College of Natural Medicine to identify the adjuvants that actually make the immune response in vaccines a lot more beneficial for that, which I think is a very timely piece of work for now.
Do you feel that more and more professionals are getting to understand the importance of synergy and?
Oh, completely. They are getting there. I think that the real difference between those professions and I guess naturopathy is those professions are learning that approach, whereas for naturopaths it's really been built
already embedded.
Yeah.
Right. Fascinating as always. Thank you so much, Professor Wandle.